Good morning and welcome. Today's topic is looking at using software, in this case particularly VMSG, for managing our program activities that support our department's services and initiatives. Okay, lots of concepts there. This presentation is about concepts. We're not worried too much about using a particular software. In this case, we're going to be talking about VMSG, but it could be any software that does this kind of thing. Um, so let's go ahead and get started with this. And I really want you to think conceptually. I want you to think about where your program's activities lie within the greater scheme of things of public health here in Cattaraugus County. Okay, to get us started, we're going to just talk about the local health system. Your programs exist within this system, right? We're the public health agency for Cattaraugus County. There are a lot of other organizations within the county that do public health things, okay? And they are all listed here. So I just want you to have this in the back of your mind as we move forward about the context in which your programs operate. So we have programs versus populations. So throughout this presentation, I'm going to be talking a lot about accreditation. Accreditation is trying to move us in a direction to become more conscious of how these things work together. And as you'll see later on in the presentation, aligning things between activities and strategies from the program level up to the local health system. Okay. So on the right here, I'm sorry, on the left here, you're going to see organizational development. And this is talking about the Cattaraugus County Health Department as an organization. I'm not going to get into a whole lot of detail here, but you can see that, there are different domains. Those are the domains that accreditation looks at, okay? And these have to do with internal stuff to the Cattaraugus County Health Department, okay? You can look at that while I'm talking. And that's versus community development. And that's looking at our whole local health system, which we've already talked about a little bit. And some of the things that accreditation looks at with regards to the community health system and the local health department's role in that community health system. So when we're looking at the local health department, we're talking about programs and program measures. When we're looking at the community as a whole, we're talking about population and population health measures, okay? Today we're going to be talking a little bit about performance management and quality improvement systems, which is domain 9, all right? And this is all reaccreditation. The efforts need to be ongoing and conscious. So we're starting that consciousness raising now by showing you how all of this kind of works together. So accreditation essentially requires us to have and implement a performance management system, okay? Performance could be managed in, for example, a software program. They really want a software program. Purchased or developed by the health department, an Excel workbook, or other mechanisms. So there is a lot of different software out there to look at performance management. Okay, VMSG is one of them, vision, mission, strategies, goals, or services goals. Okay, but there are others. And I have looked at 6 of these, and I don't. VMSG is okay. There are better ones, I believe. And we're going to continue to explore those. So this is an important slide, okay? This talks about what I call the funnel of health. I don't know where I came up with that term, but you know, the idea is to get the concept across here. So we have the community health assessment, which is the way that the local health system gets information about the community, and then the local health system, if you remember the first slide, they all put together the community health improvement plan. The health department is only one entity in that process, okay? So we scan the community using the CHA, and we try to figure out things to do to affect the community's health, the population health, and we create the chip. Okay. Now, the Cattaraugus County Health Department looks at that chip, and we have roles to play in that chip. Okay, there are things that we are essentially assigned to do. And we, as part of our internal strategic plan, we support that chip. Okay, so you can see the chip informs the Cattaraugus County Health Department. Then, one, not all, one of the, or a couple maybe, parts of the goals in the strategic plan support the chip. Okay. The strategic plan, and again, this is only some of the strategic plan is developed with regards to the local health system. That gets put together, and the divisions and programs create actions to address those parts of the strategic plan. Now, at this point, you're probably thinking to yourself, well, geez, I've heard of this strategic plan. We do it. I don't have a whole lot in that strategic plan that I'm responsible for. Okay. I actually end up being more responsible for things that are my New York State Department of Health core functions, or if I'm in home care, my home care functions. Okay. That's good, right? I mean, these are the strategic plan not only comes from CHIP imperatives and CHIP goals, but it also comes from our New York State Department of Health core functions and from our home care functions. Okay. You're familiar with the Article 6 funding, um, the 5 different things or 6 different things we have to do for Article 6. And then we also have home care, which not all local health departments have. But there can be strategic activities and strategic goals associated with improving how we're going to do those core functions and those home care functions. Okay. And then we have action plans to achieve those strategic goals. And then our action plans are actually done by our staff, right? They do their jobs, and they do their job tasks, and those action plans feed into achieving our strategic plan goals. Our strategic plan goals feed into it, achieving the chip, achieving the goals of our that New York State gives us, or the goals that we might have through our home care organizations, our home care functions. Okay. And then performance management and quality improvement is monitoring this action plan, right? And making sure that we're performing that action plan, getting it done. And if we're not getting it done, identifying that we're not getting it done or not doing it as well as we want to be doing it, and setting up a quality improvement process to handle that, right? The other thing, and this is for another presentation, is our job tasks. We can improve on those simply by improving our workforce, right? Improving the work through the workforce development plan. Okay. This is an important slide. It shows vertical alignment. Okay. It's an important one. You guys operate down here. All right. You're operating down here on the action plan level. Okay. With some input from the strategic plan. Okay. And you see that here. And you can imagine those other two arrows coming in off the side, but we function a little bit, especially as managers. You guys are going to help develop the strategic plans up here. Okay. So we are looking for alignment. We are looking for population measures to improve, but we're doing that by improving our program measures. Okay. So again, we're looking at VMSG as a planning and implementation framework. There are others out there, and frankly, in my opinion, there are better ones. But we are using VMSG at this point, um, and it's hierarchical. It can be used internal to the organization and external to the organization. So we can have other organizations be part of this. So if you think of our local health system, right? It has activities as the building block, and there are three types of those activities: quality assurance activities, project-based activities, and quantitative measure activities. We're not going to get into those today. That's for another time. We currently have 20 licenses available. There are some export functions to export the data in this database, and we're still kind of learning how to use it, but we're certainly getting better at it. We're going to use VMSG, and I'm going to walk you through this. I want you to think of the funnel of health. But any software you're going to use for this purpose is going to be organized similarly to this. It's going to use different language. They'll have different ways of talking about it, but the hierarchy will be the same, right? So you have VMSG groups that have vision, missions, and values. They provide services or initiatives, right? Those services and initiatives has goals. There are proper ways to write goals. We have to make sure we know how to do that. And again, different software might use different language for this concept of a goal. There are objectives. Objectives need to be measurable. You guys may have heard the term SMART objectives, right? Which stands for, oh my gosh, I should know this and I don't. All right, homework. You guys go type in what a SMART objective stands for, but they need to be measurable. They need to be timely. They need to be realistic. Okay, those are all part of SMART. Those objectives are accomplished by activities. This is the daily work that your folks do, right? These are work tasks. Okay. VMSG has organizational levels, right? And there's the community, there's the organizations for the local health system. In VMSG, Cattaraugus County Health Department is considered a level 1 group. Administration we've got set up as a level 2 group. Now you're starting to think about your org chart here. We'll show you that in a minute. But this essentially mimics the org chart, right? Group, the division is group 3. The program is level 4, and then each program is created by staff, right? Is administered by staff, and users are assigned to the divisions and programs. So again, our funnel of health is kind of mimicked, if you will, by VMSG and by our org chart. So here is our org chart. So this is horizontal alignment levels and plans. So let's look at this for a minute. So this is our chart on our chip. It's across group 2. It's across group level 2. Okay, so this is our, these are the folks within the department that work on the chart in the chip, right, and interact with other organizations, okay? Now you might be thinking, well, what about, I don't do a whole lot of chart and chip work, and you might do a little in your program or you might not. Where's level 2 for me? Well, level 2 for you might be kind of up at the state level with those core functions, right? The state is kind of, it's the unfunded mandates, right? The state has kind of determined what some of these things are going to be, and they've set up programs to do that. So they've, in some ways, the state has taken care of some of this for you. And similarly with home care, you guys kind of function on your own to some extent, right? And so your level 2 is sort of internally derived, all right? You kind of function as your own entity. You do need to be, as a health service provider, your home care agency, you do need to be part of the CHIP process, but you're not seen necessarily as internal to the public health um, part of things. You're kind of a direct care provider, right? So then the strategic plan is across group level 3. Okay, and again, we have the CHIP inputs into the strategic plan, we have the New York State inputs into the strategic plan, and we have the home care inputs into the strategic plan. But it goes across these divisions, okay? And we're thinking about how our different divisions can develop strategically to improve, to meet their objectives and improve. Okay. And then you have the action plan level, and that is within all of your programs, right? And so this is okay. We know what we want to do from the strategic plan. It might be, our objective might be to get 95% of the food inspections done in a timely fashion in accordance with state policy, right? We're going to have an action plan to do that, okay? And that's going to be down at this level, and those are our programs and staff, and that's within group level 3, so this would be level 4. So let's look how this shows up as vertical alignment. You have the CHIP service initiative, might be to prevent chronic disease. The CHIP goal might be, and to do that, the goal might be to improve food security. You might have an objective. This is a population objective. By December, increase the percent of adults who are food secure. Okay, this is level 2. Here is level 3. Okay, you have a service initiative which is supporting CHIP implementation. Your strategic plan goal would be increasing food insecurity to support that CHIP objective. All right, your strategic plan objective by December 2023, provide assistance in establishing food insecurity screening workflows in 5 partner agencies. That's our strategic goal at the level 3. That's what we're looking to do within the Cattaraugus County Health Department. Okay, not what the local foods health system is looking to do, but what we're looking to do within CATCO Health Department. So how are we going to do that? And that gets to the action plan, which is down at the next level. So we're going to support that strategic plan implementation, whatever goal and objective that was. And how we're going to do that is we're going to identify an easy to use screening instrument. By September 2023, we're going to review at least 3 known screening instruments and receive comment from implementing agencies. That's our objective. Okay, and staff will have activities to do that. Okay, and staff do the work under supervision. All right, action plans are formulated by directors, supervisors with staff input, stored within each service as a service or initiative. Okay, again, this is VMSG specific. May have their own goals, objectives, and activities. It's possible, depending on how complicated things are carried out by staff doing their daily and specially assigned tasks. So, you as managers have to know who your staff are, provide appropriate guidance for them, all of that stuff. Tasks within action plans are usually time sensitive, and we can capture that in a software like VMSG to provide reminders and such. Unfortunately, we don't have enough licenses to assign tasks to staff in VMSG. We only have 20. So tasks tend to be assigned to managers who then keep track of them with their staff. That's all I want to share for today. That's a lot. Okay, but think about the funnel of health. Think about the different levels. Think about objectives. I'm sorry. Think about the different types of plans and where they sit on those levels, and think about how all of this is mimicked in software. Okay. Any questions? Just give me a call, 716-472-4636, or send me an email. Thanks again. Bye.